Welcome back. You're watching the Watchdog. Well, you would have seen the president's address, the president and cabinet deciding to take the country to level 3 lockdown to try and mitigate the impact that the level 3 that we are into. 8 of the country's 9 provinces are formally on level 3. So the president saying that putting up a lot of restrictions we are going to get into in a short while. But let's now speak to the Director General of the National Department of Health, as well as Dr. Wasila Jassat, who is from the NICD. But just to get a sense of whether our public health system is going to be able to cope with this level that we are in now, considering the fact that many poor and unemployed South Africans depend on the public health system for their health needs. DG, if I may start with you, I'm sure before the president made the pronouncements that he made this evening, he would have consulted with your department and, of course, several others. Are you satisfied, as the custodians of our national health needs, that poor and unemployed people specifically, as well, of course, as the sick, the old and the infirm, will be able to be catered for if they go to our country's hospitals?
Thank you very much. Good evening to you, Buyo, and good evening to the viewers. Yes, you are correct. What normally happens is that we do take the report to the National Coronavirus Command Council, led by our acting minister, and then we are able to present. There and put up some recommendations, which are then processed through by the National Coronavirus Command Council. They go to the PCC, and then cabinet makes the final decision. But just back to your question in terms of the capacity of the health system, or what we call health facility readiness. I mean, this is not the first wave. I think we've learned from the first wave. We've built the capacity, and also during the second wave, we managed to actually navigate ourselves through, and we are comfortable in terms of the reports. I mean, our IMT, which is our incident management team, that actually is set up in terms of international health regulations. They meet twice a week to assess what's happening in the provinces, availability of beds, oxygen, the staffing, the equipment for assisting with respiratory support, and we are comfortable that as a country we will be able to manage. But of course, our capacity, I mean the public and the private sector capacity, as the minister has got stewardship over health in general, and we do get reports even from the private sector. As you would have heard the president mentioning that in Gauteng now, the private sector is actually reaching their brim in terms of the admissions.
We'll interrogate that in a short while, because there are experts who believe that the situation is not actually as great as you are making it out to be, especially around access to private health institutions in particular. But we'll get into that in a moment. I just want to come to you, Dr. Jassat. Is your assessment of what you have seen on the ground after, with some of our provinces, Gauteng in particular, started seeing or peaking?
Thanks, Vuyo. Thanks for having me. 4 provinces are clearly in the third wave, with all the other provinces showing increases as well. Cases are increasing at an alarming rate, and we are seeing increases in hospitalization, particularly in Gauteng province, which has been the hardest hit. Nationally, in the past week, admissions have increased by about 17%, and comparing the average of the past 2 weeks with the previous 2 weeks, there's been an increase of 59%. So this is a sharp rise, and I think the worrying thing, and what we learned from the first and second wave, is we need to guard against a very rapid increase in hospitalization, because that's what overwhelms our health system.
DG, what exactly, when we say we have learned a lot from the previous 2 waves, What exactly do we mean, especially from the second wave? Because you will recall that after the pandemic first hit us, and as we were going into the second wave, in many instances we were caught unawares. Things that were put in place, like the facilities that were put at stadiums, at Nazareth and so on, those had been dismantled and were largely not functional. And only when we're in the middle of the second wave were then those mistakes corrected or wrongs corrected.
Yes, no, I do agree. As I would have noted that the president did mention that as we've been responding, there has been some lessons to be learned. You will recall that during the first wave, we largely depended on the modeling in terms of how the infection was going to span out, including hospitalizations. And the preparations that were put in place by the provinces was based on those figures, which were later adjusted. And it's therefore the reason why that some of the field hospitals were not used up to capacity, because the figures that we got from the modeling, we actually did not reach those figures. But I must mention that in terms of the lessons that you're asking what we learned, one of the big issues that we had between the first and the second wave was oxygen. And hence we then started having proper planning with our oxygen suppliers to ensure that we have proper enough oxygen available in different facilities, improve the ordering, improve the replacement of the cylinders within hospitals, but also in addition using high flow nasal oxygen in the institutions, in the high care facilities. But in addition, we started putting some cryotherapy oxygen tanks in some of the facilities to ensure that we don't run out of oxygen. We've seen that now in terms of oxygen, we are really in a comfortable situation as we are moving forward. Coming to the private hospitals in terms of the access, one of the things that we've learned, it's really a very good symbiotic relationship with the private hospitals, and we've actually established some service level agreements so that it could be easy to actually admit uninsured patients in private hospitals. That worked very well in the Western Cape, and we put all the other provinces to be able to sign these SLAs so that we are able to actually share the beds with the private sector. And for us, we think this will go a long way towards establishing universal health coverage through the national health insurance. So there's quite a lot that we have learned, Buyo, but also more importantly is actually the respiratory support devices. We know for the first time in the country, we had actually through the government institute under science and technology managed to start to actually manufacture respiratory devices for the country for distribution, and 20,000 of those were actually manufactured here in South Africa, so as to be able to have our own ventilators. And we do have those that have been distributed to most of the facilities, and we have some in storage to replace those. So those are the issues that we think we have learned, and we've built our capacity to be able to deal with the issues.
Dr. Jasat, I'm sure you'll agree, if the situation is indeed going to be as Sandile Buthelezi has just described, then we have indeed moved. But is it like that? Is it what you have found as well?
You know, right after the second wave, the IMT started engaging around what our lessons had been in the first and second waves, and started working with provinces to prepare for the third wave. So this has been many months in the making, looking at bed capacity, looking at surge capacity, particularly during the peak of the wave, and looking at oxygen and staffing as well. What we're seeing right now is an increase in admissions, particularly in the private sector in a few provinces. So in Gauteng, currently 4,400 patients are admitted, of which over 3,000 are in the private sector and about 1,000 in the public sector. So it seems like the resurgence proceeded in the private sector, and we know that the Gauteng private hospitals have reached capacity, and many of them are on divert. Public hospitals have not reached capacity as yet, and there is contingency in Gauteng for when surge capacity is required. Based on projections and modeling that they've done, even if they reach the peaks of the second wave, they believe that there are sufficient beds. I think there are always questions around staffing being sufficient, but in terms of bed and oxygen, Gauteng Department of Health believe that the public sector are covered. I think we have to prepare for the eventuality that this peak is much bigger than the second wave was, and I think we have to be resilient, adaptable, and agile in terms of creating capacity where it's needed.
DG, there are people asking, why is Gauteng not being made a special case? Should it not have been, or should it not have been really put in a situation where there is a bit of a harder lockdown than compared to the rest of the country?
Yes, thank you very much. That's actually the decision of the NCCC and Cabinet.
But did that conversation even come up at all?
No, it did. Let me just explain that what then happened is that normally before we go to the National Coronavirus Command Council, the minister would meet the MECs of health through what we call the National Health Council, just to actually canvass them on these issues and get their own inputs, so that as a health sector, we actually go in with a consolidated, comprehensive proposal to the National Coronavirus Command Council. And this was actually discussed in this meeting, and there was a feeling that if you actually use what is called differentiated approach, it might be difficult, because as much as we've got 4 provinces, as Dr. Jassat was saying, that are technically in the third wave, very soon we are seeing the other provinces are coming up, so it's going to be a matter of days that the others are also in the third wave. So that will mean that we'll be playing around with the restrictions in different provinces. But also we have soft borders. We have soft borders as a country. And if you look at a place like Gauteng, you've got people who actually stay in Mpumalanga, stay in Northwest, stay in Free State, who actually work in Gauteng and travel to Gauteng every day. So it becomes very difficult in terms of enforcement. And whenever we set up these restrictions, they go through what we call nut joints. We need to ensure that the people who also need to enforce their work is not made very difficult. So there was an input that we should be considering this. But of course, at the end of the day, considering all the variables that need to be considered, the cabinet decided that we need to go throughout the country, as all the provinces, as the president mentioned, all the provinces are actually on an upward trajectory.
So the issue was that it would have been difficult, if not impossible, to monitor it.
And not only that, Vuyo, as mentioned, is that it's just that these other provinces have moved faster. But if we are looking at the trends currently, as we are seeing, as Dr. Jassat mentioned, all the provinces are actually increasing and are approaching the third wave. So we believe that it's a matter of time that all the provinces will actually get into the third wave. So it's better that we are actually implementing throughout the country and also just to make sure for easy enforceability.
And did the issue of schools come up at all?
Well, it was discussed, the issue of schools, but of course there are already some measures that have been introduced by the Department of Education to ensure that there is mitigate, like the cancellation of contact sports and managing infections within schools. So that one was actually discussed, but it's something that was not really going to make much difference if it was implemented.
So you're all convinced that closing schools would not really help curb the spread of COVID-19?
Yeah, it is something that is quite difficult, because we do need to try and sustain the schooling. There's been a very strong case that has been put forward by the sector that there's been a lot of schooling time lost, and we don't want, at the end of the day, to actually, in the later years, feel the brunt of a disrupted education system. But we are trying to balance the issues, and if issues do come up at a later stage to be problematic, we think that could be managed at that particular time.
Dr. Jassat, your thoughts on the decisions around education and putting some provinces, or the provinces that are leading, on a harder lockdown?
I mean, the evidence is that in this wave, there's a higher incidence of cases amongst teenagers, 15 to 19, than we saw in the first and second wave. And that's probably because in the first wave, schools were closed. In the second wave, it was school holidays. And I think the worry with that is they don't get very sick, but that they do pass it on to vulnerable people back at home. I mean, I do also acknowledge that the pandemic is not just a health crisis, and it's about economics and politics and social issues. And so I think that all of these things come to play when making these decisions. But, I trust that the evidence is being considered and the best decisions taken. I mean, we certainly do know that, young children and teenagers are not at high risk for severe disease, but that if they do transmit to those at high risk at home, they are the ones that get sick and get admitted in hospitals, and we need to guard against that. But I think that what this calls into play is not just the national restrictions. I think we also have to think about, our public health and social measures. I mean, there is certainly pandemic fatigue, and I think, we need guard against having gatherings. We need to guard against, socializing without proper mask wearing. And, especially I think the message to get across is that if anyone has symptoms, to isolate and for their contacts to quarantine. We need to cut the chains of transmission. And so that's irrespective of what national restrictions are in place. I think that there are, citizen responsibilities that we all must bear in order to be able to curb this wave.
DG, I just want to take you back to an issue you touched on a little earlier about private hospitals, because from reports over the weekend, it was said that already private hospitals were not accepting patients, and it was also reported that when ambulances actually, when private doctors take, there was a report today, I think it was in Sowetan, where ambulances that, have to take patients, the minute they call the hospitals tell them that they are not taking any patients. Do you know anything about that? And if it is indeed true, what should be done, or what will your department do?
Yes, thank you very much. Actually, in our meeting this weekend, the minister, or acting minister, we visited Gauteng and we met with the premier and MECs in Gauteng, and they presented. And one of the issues they raised, of course, is that private hospitals in the province are actually reaching their capacity. And we've seen that also in terms of the statistics. But we still have some capacity within the public sector. And we do agree that we have received that kind of a report. And what Gauteng has done currently, just like the Western Cape and the other provinces, is to establish what we call a provincial bed bureau, where they manage the beds to ensure that both public and private, so that people, when the emergency medical services are picking up the people, they are able to be directed to where there is availability of beds. So that's a way that you should be able to manage it. Actually, the ambulance people should not be taking, they should be guided through the bed bureau to take the people to where there is actually a bed, rather than being moved from that hospital to that hospital to that hospital. However, I must agree that the minister has received some calls, and I've also received some calls where people have not been finding some beds in some private hospitals, because maybe some of them, they prefer to go to those particular private hospitals. But we actually want to actually request our communities that we will be trying to ensure that there are beds available. You might not get a bed to where you want to go, maybe by preference, but to where there is a bed, so that we have a rational use of beds. Hence, then we had pushed for service level agreements with the private sector, so that we're able to rationalize the use of beds in all the provinces.
Quick last word from you, Dr. Chasad.
Yeah, I just want to echo, a lot of what the DG has said as well, and to say that, we must not be complacent. We must be able to respond to the crisis at hand. We know that we struggled in the first and second wave when bed pressure was high. Our case fatality ratio in the hospitals increased dramatically in both the public and the private sector. And in fact, this has been described in other countries as well, that when there's a strain on beds, mortality and deaths are higher. And so I think we need to guard against getting to those very high levels of hospitalization because the hospitals do not cope. And so, yeah, again, I mean, I think, I'm encouraged to see the national level restrictions raised and just appealing again to the public to do their part and also appeals to the provinces to ensure that, all levels of preparedness are taken.
A quick last word from you, DG, if you could address the issue of vaccination. The president's still confident that we're going to deliver on this, especially for the over 60 over the next month or so. But of course, South Africans aren't happy at all. No one seems to be happy at the way things are progressing thus far.
Yes, thanks, Vuyo. I think the president addressed this very well in his speech. I must say that the supply constraint is what has been limiting our capacity. We are actually working very close with the private sector. I actually chair the meeting with the private sector at least twice a week through Business for South Africa, and to ensure that we have sites that are active in both public and the private sector. And we've been able, as the president mentioned, to increase our vaccinations. When we started with Sonke, we're doing about 10,000 vaccinations per day. We are now able to do more than 80,000 vaccinations per day. And our current capacity, if we did not have the vaccine limitations, we will be able to do about 150,000 with about 122,000 in the public sector and just less than 30,000 in the private sector. And this capacity, we are planning to increase it to 250,000. And of course, you heard the president, he said he would prefer 300,000 as we move forward. But what is more important that the president mentioned is that by the end of this month, we would have received just more than 3,000 Pfizer doses. Currently, we've received just 2.4 and we're getting deliveries every week. But more importantly, Johnson & Johnson, we are led by our minister. We had a very good meeting last night. Now, to replace the doses that will be destroyed at Gqeberha because of the contamination, they have committed to deliver 2 million doses from the US direct to South Africa, with the first 300 coming by the end of this week, and the remainder coming thereafter. And with these doses of J&J, they will supplement the Pfizer, but we will be targeting some frontline healthcare workers, the educators, the security cluster, and their advanced plans in place. We just want to request the South Africans to register, find a mechanism to register, but especially for the 60 years and above, they have to get to the vaccination sites. Even if they are struggling to register and we don't turn them away, we've spoken to all our provinces that they get assisted in terms of getting vaccinated. This is what is going to help us, and we believe that with the flow of vaccines going to come now in a much more stable way, we will be able to start moving as fast as we can without the supply constraint.
Director General for the National Department of Health, Sandile Buthelezi, and Dr. Wasila Jassat from the NICD, thanks to both of you for gracing us with your presence this evening. Of course, we're going to continue with the reactions to what the president announced a little earlier. I'm now going to bring in the leader of the Democratic Alliance, as well as the national chairperson of the Economic Freedom Front. Good evening to both of you, and thank you very much for your time. If I may start with you, John Steenhuisen, your thoughts on what the president had to say this evening?
Well, it's very clear the president's boxed in. I mean, there's not much else that he could do, given the fact that we remain one of the least vaccinated nations in Africa and in the world.
So you feel for him?
It's interesting to hear that. Pardon?
You feel for him?
No, I don't feel for him, because it's a situation of their own making. That's why I thought it was quite interesting that the DG is talking about supply constraints. We wouldn't have supply constraints if we'd got into the queue when we should have, when other countries had got into it. It is the reason we've been left behind in the vaccination race by countries like Zimbabwe, by Malawi, by many other of our peers on the African continent. And we go into this third wave, one of the least vaccinated countries and citizenry in the world. And I think that government's got a lot to answer for. It's also, the president's very good at throwing out big numbers, but never explaining how we're going to get there. We're currently vaccinating 70,000 people per day. What is the path to vaccinating suddenly in a couple of days 250,000 or 300,000, as the president said he'd like to get on board? Every single one of the vaccination targets government has set for itself, it has missed. We were supposed to have vaccinated 1 million people by the end of March. Well, we've just gone over the 2 million mark now. And there is clearly a problem with government's procurement of the vaccines. And that is largely as a result of the fact that government sat on its hands for over a year when other countries were procuring them. That has left many South Africans now at great risk of contracting the virus now in this third wave. That would not have been had we run a successful vaccination program, as many of our peer countries on the continent have done over the course of the last few months.
Veronica
I was in
Mentor?
Somaliland.
Your thoughts on what the president had to say this evening?
Thank you and welcome back. I heard a lot of nothing, because what we have expected was a clear rollout plan in terms of the vaccination in order to save lives. If one has to say now we want to save lives, the only way is through vaccination. And if that plan is not clear, if that plan is not rolled out in a proper manner, where province by province is accounted for on where are the sites, where should people get their vaccination, and how should this whole process go about, then you are not talking to us. We are more like abazulwana bakagogo, sitting around listening to intomi. There is absolutely nothing that the president is telling us. He's telling us what we know. He's telling us what we have been doing. He's been saying to us, let's social distance, let's stay at home, curfews, wear masks, everything. We have done all of that as a people. But what is government doing? What is he doing for his people? Nothing. And therefore, there's nothing that he has said. It's even worse that he's not closing schools. I think it shouldn't shock us, by the way, because that's what this government is good at, killing people. Children must first die, then they will realize that the schools must close. The logic of school having lost a lot of time and all that, time can always be recovered, but lives can never be recovered. So I do not understand. I don't know what he was telling us. I couldn't understand what he was saying. I couldn't hear his message because there's absolutely nothing he's bringing on the table. He is telling us to do what we have been doing. We've been sitting like this. We have been saving our lives the best way we know how as a people, and the government is not coming into the party.
Well, the South Africans who voted for both your parties are looking up to you to find ways, often innovative ways, of actually holding them to account. If they are not delivering, have you exhausted all the armory that you've got, the legislation that you have in your favor that allows you or forces you actually to hold them accountable? Have you done it, John Shazen?
Well, yes, but the government has used the lockdown to, remember, shut down Parliament for an extensive period. So there was a large part of 2020 where Parliament wasn't sitting and the government was running amok with no oversight. That has since improved, but we don't get straight answers. I mean, the health minister has been dodging the health portfolio committee meetings because he's terrified he was going to be asked about the digital vibe scandal where it's alleged that associates of his have profited out of this pandemic. So there's been very little oversight and accountability facilitated by government using the guise of the disaster management regulations. What we have done today is table a request in Parliament for an ad hoc committee to be set up to investigate government's procurement of vaccines. The president's constantly going on about vaccine apartheid and these big, terrible Western countries that have hoarded vaccines, when in fact the reality is that his government didn't get off its hands and do what needed to be done. It's why many of our other peer countries, as I was trying to tell you earlier, I was in Somaliland 2 weeks ago to monitor the election. We were all offered vaccines while we were there. How can a small, non-recognized country like Somaliland be able to roll out vaccines at a better pace than South Africa can? It's clearly something fundamentally wrong, and there needs to be an investigation because The lives and livelihoods that are now destroyed in this third wave could have been avoided had we been able to roll out a vaccination plan and had we had a credible plan on the table to be able to do so.
Quick one, Veronica Mente. Have you thought of new, innovative ways of holding them to account, saying that they are running away, as John Steenhuisen says, from accountability?
You know, when we started complaining about the PPEs not reaching hospitals, about money that's supposed to reach people not reaching them, and dealt with ministers that are responsible for those departments, we were called names, we were called to be the ones that are harsh, we don't understand and all that. We gave them space to do all these things and to do everything they can. We still called upon them to work with them to say, in order for all of us to reach herd immunity, that's required in order for the country to at least be safe from the virus. Let's go and appropriate the funds through Parliament. We will offer our own percentages, the EFF, to say, take whatever money you require. Projects at this point are not more important than the lives. They came to Parliament, they appropriated money, but then they misused it. And there's absolutely nothing we can do through the Parliament in terms of holding them accountable because they use majority to pass whatever they want to pass. But the little we can do through law enforcement, SIUs, HOS, and some committees of Parliament that find it not difficult to call ministers, some of them that do not come like John Steenhuisen is saying. They do that. But the most important weapon that is in the hands of the public right now is to protest. We're going to have to go and get the vaccine at the doorstep of Ramaphosa if we have to.
Okay, that's where we're going to leave it, unfortunately. We have run out of time. Thank you to both of you for coming through this evening. The leader of the Democratic Alliance, John Steenhuisen, and Veronica Mente, the national chairperson of the EFF. Please remember to follow us at the Watchdog SABC on Twitter and to share your views on our Twitter timeline. That's all we have time for. Till we meet again tomorrow evening, same time. Thanks very much for watching.